If you're running with a hip drop, your running form might look something like this. One side of your pelvis is lower, and then the weaker side is actually going to be higher. Because the gluteus medius does contralateral pelvic stability, so if our right gluteus medius is weak, our left pelvis is going to be lower than our right side. The problem with addressing hip drop is that most traditional PTs are only going to address gluteus medius weakness. This is a mistake because not only do we need to strengthen the gluteus medius, but we also need to strengthen the gluteus maximus. Both of those glute muscles are working together to keep our pelvis nice and stable. To fix hip drop, the first thing I recommend working on is your single leg squat. So you're gonna stand on one leg, hands on your pelvis, and you're just gonna be a couple inches from the wall. So if I'm working on my right side, then my left leg, my heel is gonna be on the ground, kind of in this like kickstand position. All I'm gonna do with my hands on my pelvis, so I'm keeping my pelvis nice and stable, nice and level, and I'm just gonna squat down, tapping my butt into the wall. Now when I'm doing this, I'm really working on getting my glutes back, loading my glutes, and also keeping my pelvis level, which is exactly what we need to do in stance phase when running to avoid hip drop. The other thing I recommend working on is a single leg hinge. So I'm gonna place one foot against a block, you can put it against the wall, and I'm just gonna focus on hinging back because when we work on this hinge, we're really focusing on loading that posterior chain. So I'm gonna have a slight bend in my leg that's on the ground, and all I'm gonna do, keep my back flat, and I'm just gonna focus on getting my glutes back as far as I can. I'll feel tension in the glute and in the hamstring to know I'm doing it correctly. You really shouldn't have any pain or tension in the low back. And when I'm doing this, I'm keeping my pelvis level and I'm really focusing on that hip flexion where I'm eccentrically loading the glute max and the hamstring and then into hip extension. And yes, this also works the gluteus medius because I'm in a single leg position.